Hello everyone. Today, we're exploring a medication called Ganciclovir, known by its brand names Cytovene and Vitrasert. As always, our discussion is for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Ganciclovir, recognized by its brand names Cytovene and Vitrasert, is an antiviral medication primarily used to treat cytomegalovirus (CMV) infections. It belongs to a class of drugs known as nucleoside analogues, which work by inhibiting the replication of viral DNA. This medication is particularly important for individuals with weakened immune systems, such as those with HIV, AIDS, organ transplant recipients, and patients undergoing chemotherapy. Ganciclovir is used to treat CMV retinitis in immunocompromised patients and for the prevention of CMV disease in transplant recipients. Available in oral, intravenous, and ocular implant forms, it helps control CMV infections and prevents their progression. Warnings: Ganciclovir carries several important warnings. It's known to cause serious side effects, including bone marrow suppression, which can lead to reduced blood cell counts and increase the risk of infections and bleeding. Regular blood tests are necessary to monitor your blood cell levels during treatment. Ganciclovir is also teratogenic, meaning it can cause birth defects, so it should not be used during pregnancy unless absolutely necessary. Both men and women should use reliable contraception during treatment and for at least 90 days after stopping the medication to prevent pregnancy. Before taking this medicine. Before starting Ganciclovir, several factors need consideration. Inform your healthcare provider if you have any allergies to the drug or its components. Those with kidney disease need to discuss potential risks and benefits with their doctor, as Ganciclovir is primarily excreted by the kidneys. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider due to the potential risks to the baby. Regular monitoring of blood cell counts and kidney function is essential during treatment. You should not take Ganciclovir if you have severe kidney disease and are on dialysis. It's also important to inform your doctor if you have a history of low blood cell counts, as Ganciclovir can exacerbate this condition. If you are scheduled for surgery or certain procedures, inform your doctor as you might need to stop taking Ganciclovir temporarily. Side effects: all medications can have side effects, and Ganciclovir is no exception. Common side effects include fever, diarrhea, nausea, vomiting, and abdominal pain. More serious side effects can include bone marrow suppression leading to anemia, leukopenia, and thrombocytopenia. Symptoms of these conditions include unusual bruising or bleeding, fatigue, and signs of infection such as fever and chills. If you experience any of these symptoms, contact your doctor immediately. Additionally, Ganciclovir can cause kidney problems, so it's important to stay hydrated and report any changes in urination to your healthcare provider. Other potential side effects include seizures, confusion, and mental or mood changes. Ocular implants can cause eye pain, vision changes, or retinal detachment. If you notice any severe or unusual symptoms, seek medical attention promptly. Interactions: Ganciclovir can interact with other medications, potentially increasing the risk of side effects or reducing effectiveness. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking. Notable interactions include other medications that suppress bone marrow, such as zidovudine and mycophenolate, as well as drugs that affect kidney function like nonsteroidal anti-inflammatory drugs, NSAIDs. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Ganciclovir. For CMV retinitis, the typical initial dose is 5 mg per kilogram intravenously every 12 hours for 14 to 21 days, followed by a maintenance dose of 5 mg per kilogram once daily. For oral administration, the usual dose is 1,000 mg 3 times a day with food. Dosage adjustments may be necessary based on kidney function and blood cell counts. Never alter your dosage without consulting your healthcare provider. Avoid: while on Ganciclovir, it's essential to avoid activities that could increase your risk of infection or bleeding due to potential bone marrow suppression. Avoid contact with sick individuals and practice good hygiene. It's also advisable to avoid alcohol, as it can exacerbate certain side effects. Stay hydrated to help protect your kidneys, and avoid activities that require alertness if you experience dizziness or confusion. FAQ: Many wonder about the age restrictions for Ganciclovir. Its safety and effectiveness in individuals younger than 12 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Ganciclovir. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.